This video shows you how to check the young infant for a feeding problem or low weight, including how to assess a breastfeed. First, ask the mother,
is the infant breastfed?
If the mother answers yes, ask,
How many times in 24 hours?
Next ask,
Does the infant usually receive any other foods or drinks?
If the mother answers yes, ask,
How often?
then ask,
What do you use to feed the infant?
determine the young infant's weight for age. You need to assess breastfeeding in the following way. Ask,
Has the infant breastfed in the previous hour?
if the young infant has been fed and is not interested in feeding, ask the mother to wait and tell you when the young infant is ready to feed again. If the infant has not fed in the previous hour, ask her to put him to the breast. Observe the breastfeed for 4 minutes. Is the infant able to attach? Look for the 4 signs of good attachment. Good attachment is essential for the young infant to feed well.
The 4 signs of good attachment are the chin touching the breast, the mouth wide open,
The lower lip turned outward,
more areola visible above than below the mouth,
This young infant is well attached with the chin touching the mother's breast.
This young infant is attempting to feed with its chin not touching the breast. There is an obvious gap between the young infant's chin and the mother's breast. This child is not well attached. When the young infant is well attached, the mouth is wide open. This young infant is feeding with its mouth wide open.
This young infant is feeding with its mouth partially closed. It is not well attached to the mother's breast and is therefore having difficulty feeding. When the young infant is well attached, the lower lip is turned outward. With this young infant, you can clearly see the lower lip turned outward while he is feeding.
With this young infant, the lower lip is turned inwards. It is not well attached.
When the young infant is well attached, more areola is visible above than below the young infant's mouth. With this young infant, you can clearly see more areola above than below the mouth.
If there is the same amount of areola above and below the young infant's mouth, as in this child, or if there is more areola visible below than above the child's mouth, the young infant is not well attached.
When a young infant is well attached, as in this case, he shows all 4 signs of good attachment.
Then look to see, is the infant suckling effectively?
When a young infant is suckling effectively, he takes slow, deep sucks. Sometimes he pauses, and then starts suckling again. You may be able to see him swallow. This young infant is suckling effectively. This young infant is not suckling effectively. The young infant is making mostly rapid sucks. You cannot see swallowing. A young infant who has had a good breastfeed will stop suckling and release the breast spontaneously. He has had enough and is satisfied. He has lost interest in the breast and he appears relaxed and sleepy. This young infant demonstrates the signs of good attachment. The chin is touching the breast. The mouth is wide open. More areola is showing above than below the young infant's mouth. However, you cannot see the lower lip. This is because she is very close to the breast, making it very difficult to see her mouth at all. This sometimes happens with babies who are very close to the breast. We asked the mother to hold back her breast so that we could see what was happening with the lower lip. You can see that the lip is turned outwards. If a baby is very close to the breast and shows the other signs of good attachment, the young infant is probably well attached. You do not need to hold back the mother's breast to check the lip. You can see that this young infant is giving slow, deep sucks, sometimes pausing and swallowing. The young infant is suckling effectively.
Look for ulcers or white patches in the mouth. Ulcers or thrush can make it difficult for the infant to suckle.
If an infant does not suckle effectively, the breast milk does not flow well, and the infant gets it slowly. He may want to suckle very often, or for a long time, or he may gain weight too slowly. If an infant is poorly attached or not suckling effectively, you should help his mother to position and attach him better.